The spirit of never-ending love.
Well, basically, JPS told us that, if you recall, if we could get a proposal to them by a certain Friday, which was like a week from then, that they would fund it, because it was right in the middle of their budget session. It was really quite something. And so I had written several little papers on school-based clinics and done some research, and so I had those little pieces of paper. So we went out here and took pictures, if you recall. I wanted a picture on the application so it would look real. And we threw that together and put the numbers in it. And the hardest part was getting the signatures. We had like one day to get everybody corralled and signed for it. And I knew it would go, because they told me. So what we had is a willing provider with JPS. What we didn't have is the Southside Church of Christ. And the minute you put that piece in there, it was ready to go.
We put the proposal into JPS, and as the elders and ministers talked about it, we kind of took a pretty passive approach, and we kind of thought, well, if this is of God, then I'm sure God will see this proposal through. If not, then I'm sure He'll stop it. And JPS approved one proposal for a school-based health clinic, and it was ours.
Initially, when the clinic was proposed, we looked at some of the issues about the building itself and where it was located, and the fact that it's on our campus, and there's some zoning issues and all sorts of things that would probably bore everyone to tears if I were to go into it. But the other thing is, of course, since Southside is supporting the clinic, but it's in fact being run by JPS through its affiliation with Fort Worth ISD, we had to put together legal documents that would describe that relationship appropriately, and so that both the school district and JPS would have the appropriate permission to be on our property, and the protections necessary for the church, as well as the different services that the church is going to provide to the clinic.
We have a variety of arrangements for school-based clinics within the Fort Worth ISD. We have 2 school-based clinics located in 2 of the 4 family resource centers. So families can go there and have their medical needs as well as their mental health or behavioral health needs addressed. And again, there's a great deal of collaboration among the staff. We also have a standalone building on the campus of Eastern Hills Elementary. We have a collaborative arrangement with the Birdville ISD in Haltom City. And then, of course, this newest venture with the Alliance broadens the scope of the way in which we can open school-based health centers in the Fort Worth ISD.
It was unusual that a school-based clinic was not going to be at a school, but the school district was very grateful that Southside was willing to offer up our small building for the clinic space.
Well, some of the issues had to do with the use of the building, the previous use of the building. It was a storage building. It's been a school. It's been a home for children, and it's been a bus barn, and so it's had a lot of usages, and it has not been used for occupancy in a good while. So we had to get some foundation work done. We had to get some asbestos out of the building so we could take all the interior walls out. And the process involved drawings, design work, working with JPS and layout like they wanted, and then obtaining production drawings. And so taking all that to the city and getting city permits before we could start.
One of my big desires was to have members of our church working within the clinic. And I was speaking at Harding's lectureship in 2009, and one of my good friends that I grew up with, Louisa Duke, was there, just happened to be there.
And he stopped me and was asking what I was doing, and then told me all about this new clinic that y'all are going to open with JPS. And I told him I was looking for something to do, and as he told me about it, I thought more and more that sounded like it might be the perfect fit and a place where I could combine my love for children and ministry and working with underserved people. And so I decided to come just kind of on a survey trip to make some connections with people and learn about Fort Worth, learn about Southside, learn about JPS. So I came for about a week and stayed with Chloe Carter, and she taught me all about Southside and the ministries here. And then I got to meet with some people at JPS, and I really loved what I saw and learned all about the clinics. And by the end of my time here, I was able to have an interview with some of the leaders in the clinic program at JPS, and I just really loved what I saw and was excited about it and hoping to get the position. And so soon after I did, and now I'm here.
I requested from our department chair, Dr. Joni Balmer, to be the medical director for this clinic since it was going to be on our campus, so that I personally could be involved in that. Through the Department of Family Medicine, we run those school-based clinics. And Louisa, now that she's here in Fort Worth, has been working in one of the other school-based clinics until this one is completed. So she and I would work together, as we have been through the past year or so that she has been here. I help her with questions or referrals or filling out paperwork and signing forms for her and reviewing charts. And then she can come to me with any need that she has.
That comes from above.
Give me water from above.
We elders pray constantly for God to give us opportunities to serve our neighborhood and to shine His light here at Southside. And I know that that same feeling is shared by the family here at Southside. And we certainly see this as an answered prayer. God has given us an opportunity, and sometimes opportunities aren't always easy or immediate, but it is a faith-building process. It gives us all time to think and consider carefully what we're doing, and I think we've all had plenty of time to do that. But it's a way to glorify God while also showing mercy to our neighbors and being missionaries to our neighborhood as well.
I feel like as a church with this new clinic, it'll be a great opportunity for volunteers to come in and share that light with our patients that come. And, when you're sick, it's just nice to have someone who is light and who is joy and who is love. And I feel like this is a great place for us to show that to these people who are suffering and who, in whatever way they're suffering, whether it's lack of money and needs for health care or just a sore throat. So it's just a great opportunity to be a blessing to people.
Anytime we talk about the clinic, the first thing is how can we get involved? What can we do to volunteer our time? Everyone seems to be very excited about the clinic, and we're just looking forward to it opening.
I think we here at Southside have a unique opportunity to be involved in the lives of many of the children in Tarrant County. There are very few churches that are involved in these clinics, and the majority of the work goes through the school system and through our Department of Family Medicine. So by providing a location, the site, we have a unique way to serve these children, especially the ones that live in our community, who we might already be serving through other means as well.
Well, I think one kind of final thing that I would like to say is I think this is a time for us as a church to get ready to minister and to serve our neighborhood and others. God has placed us in this neighborhood, and He has been working transformation in our church to be missional in our outlook. And I think this is just another piece in that puzzle. And so I think one thing that this clinic should cause us to do as a church is to get ready to minister and to serve, because the people are going to be here. God's bringing the people here. Now the question is, are we going to be ready to serve and to welcome them and to touch them?